Hi, welcome to the Healthy Life channel. Imagine you're enjoying a healthy breakfast with a glass of orange juice and a slice of banana. You think, this must be good for my body. But what if I told you that for people with kidney disease? This food can turn into something dangerous, and in some cases, it can even cause fatal heart problems. Every day, without realizing it, many people with kidney problems eat foods that secretly worsen their condition. They feel healthy, but inside, their kidneys are struggling to handle too much weight until unexpected complications arise. And more surprisingly, some of the fruits most often considered healthy are actually on the list of foods to avoid. So, are you sure the fruits you are currently consuming are not harmful to your kidneys? Because after this video, maybe you will start looking at some foods in a different way. 1. Bananas. Bananas are one of the most consumed fruits in the world due to their delicious taste and wide availability. However, for people with kidney disease, bananas can be very dangerous because they are very high in potassium, about 358 milligrams per 100 grams. In healthy people, the kidneys function to remove excess potassium through urine, but in patients with chronic kidney disease, CKD, the kidneys are unable to perform this function properly, leading to a buildup of potassium in the blood, hyperkalemia. This condition can cause heart rhythm disturbances, arrhythmia, muscle weakness, and sudden cardiac arrest if not treated properly. Other symptoms that can arise due to hyperkalemia include tingling, nausea, and respiratory distress. People with kidney disease are advised to avoid bananas or replace them with low-potassium fruits, such as apples or berries. 2. Oranges and orange juice. Oranges are known as a fruit rich in vitamin C and are often consumed to boost immunity. For people with kidney disease, oranges can actually be a dangerous fruit because they contain high amounts of potassium, about 250 milligrams per fruit. Excess potassium in the blood can cause extreme fatigue, nervous system disorders, and muscle and heart problems. In addition, oranges are acidic, which can worsen the metabolic conditions of people with kidney disease. This is especially true for those with metabolic acidosis, a condition in which the body becomes too acidic because the kidneys are unable to remove excess acid. Kidney patients with hypertension should also be careful with oranges, as their potassium content can worsen already unstable blood pressure. Alternatively, fruits such as apples, pears, or grapes are safer to consume as they have lower potassium levels. 3. Melons, cantaloupe, and honeydew. Melons have a high water content, but for people with kidney disease, they can be a problem due to their high potassium content and excessive fluid. For example, cantaloupe contains about 430 milligrams of potassium per 100 grams, which can cause a drastic increase in blood potassium levels. In addition, kidneys that cannot function properly will have difficulty controlling the fluid balance in the body. Consumption of fruits that are high in water, such as melon, can cause fluid accumulation, edema, high blood pressure, and shortness of breath due to fluid retention in the lungs. Kidney patients, especially those on dialysis, often have to limit their fluid intake to avoid these complications. Therefore, they are advised to avoid melons and opt for fruits with lower water content, such as strawberries or apples. 4. Avocado. Avocados have unsaturated fat content that is good for the heart, but for kidney patients, avocados can be a very dangerous fruit. Avocados contain very high potassium, even higher than bananas, which is about 700 milligrams per medium fruit. If consumed by people with kidney disease, especially those with advanced chronic kidney failure, this excess potassium can cause irregular heartbeat, arrhythmia, muscle weakness, and even heart failure in extreme conditions. In addition, the fat content in avocados, although healthy, can be an additional metabolic burden for kidneys that are already not functioning properly, especially if the patient has nephrotic syndrome, where the kidneys leak protein. Therefore, avocados are not a good choice for kidney patients, and it is better to choose fruits such as apples or pears that are lower in potassium. 5. Kiwi. Kiwi is a fruit that is rich in vitamin C and fiber, but it also has a high potassium and oxalate content, making it less suitable for kidney patients. Kiwi contains about 312 milligrams of potassium per fruit, which can cause an increase in potassium levels in the blood if consumed in excess. In addition, kiwi also has high levels of oxalate, which can aggravate the condition of calcium oxalate kidney stones, the most common type of kidney stones. If a person with kidney disease has a history of kidney stones, kiwi consumption can worsen the formation of these stones and cause severe pain. Since kiwi is acidic, kidney patients with acid reflux or indigestion may also experience stomach irritation after consuming this fruit. Therefore, it is better to choose safer fruits such as grapes or berries. 6. Tomatoes. Tomatoes are botanically a fruit, but in the culinary world, they are more often considered a vegetable. Tomatoes are a very common fruit consumed all over the world, either in fresh form, sauce, or juice. However, tomatoes are very high in potassium, about 290 milligrams per 100 grams, which can be dangerous for people with kidney disease. In addition, tomatoes are also often processed into sauces or juices, which increases the potassium concentration even higher. Excess potassium from tomatoes can cause hyperkalemia, heart rate disturbances, and muscle weakness. Tomatoes also contain oxalic acid, which can aggravate oxalate kidney stones and cause discomfort for patients prone to kidney stone formation. In addition to their potassium content, tomatoes also have a fairly high phosphorus content, which can increase the risk of hyperphosphatemia, which is excess phosphorus in the blood that can lead to bone loss and heart problems. Therefore, kidney patients should avoid tomatoes or limit their consumption strictly according to the doctor's recommendation. Better alternatives are low-potassium vegetables, such as bell peppers or cucumbers. 7. Papaya. Papaya is often consumed to improve digestion, but for kidney patients, papaya is not a good choice due to its high potassium and phosphorus content. Papaya contains about 286 milligrams of potassium per 100 grams, which can cause hyperkalemia in kidney patients who cannot get rid of excess potassium efficiently. Papaya also has high levels of phosphorus, which can cause hyperphosphatemia and lead to bone damage and hardening of the arteries. If the kidneys are unable to remove excess phosphorus, then patients can experience severe itching, joint pain, as well as an increased risk of heart disease. Therefore, people with kidney disease are advised to avoid papaya and choose low-potassium fruits, such as apples or strawberries. Those are some fruits that should be avoided by people with kidney disease. People with kidney disease should be careful in choosing fruits, especially those that are high in potassium, phosphorus, and oxalate. Therefore, it is very important for kidney patients to consult a doctor or nutritionist before consuming certain fruits in order to maintain kidney health. This video is for educational purposes only. If this video is useful, don't forget to like and subscribe so as not to miss other videos.